We interrupt this Trimet scanner for this. Let's see here. This is the crisis response model update, everybody. Okay, this isn't a Trimet meeting, but it's a MSO Trimet Multnomah County. So the multimodal bureaucracies are going to discuss this. So this should be fun to watch. So let's turn it on for something different for a change.
And the elements of planning, including but not limited to the scope of work, timeline, budget implications, and current progress. Next slide, please. Presenting with me today is Multnomah County Sheriff's Office Equity and Inclusion Manager Rebecca Sanchez, Multnomah County Health Department Director Ebony Clark, Trimet Senior Community Engagement Specialist Marissa Clark, and
Senior Community Engagement Specialist, not a Junior Community Engagement Specialist, not a Senior Community Engagement Generalist. No, we have a Senior Community Engagement Specialist.
Behavioral Health Reimagined Community Coordinator Leah Drebin. We are excited to welcome Leah today as she brings a variety of experience to this new role, and we are looking forward to partnering with her in this endeavor. We would also like to recognize Trimet's new Executive Director of Safety and Security, Andrew Wilson.
That's me.
Andrew has held previous roles with Trimet as the Director of Risk Management and Interim Director of Safety, and we're happy to have him here as part of our team. Next slide, please. As we have navigated the implementation of MCSO leadership of the Transit Police Division, we immediately built collaborative relationships with Trimet, and our proven commitment to providing exemplary public safety services was highlighted and recognized with the Board of County Commissioners' approval of the intergovernmental agreement in the spring of 2021. As part of the IGA approval, the Board of County Commissioners included a budget note and requested for MCSO and Trimet to partner with the Multnomah County Health Department to create a behavioral crisis response model. Since then, we have been working with Trimet and the Health Department to develop the framework to implement a model. The position, including its scope of work, timeline, and budget, was created and developed. And at this time, I would like to welcome Multnomah County Health Department Director Ebony Clark to share more about this new role. Next slide, please.
Good morning, Chair, Commissioners. My name is Ebony Clark, and I am the Health Department Director. My pronouns are she, her, hers. In the Health Department and Behavioral Health, we are excited to be partnering across systems to work on innovative ways to bridge gaps for individuals experiencing behavioral health challenges in our community. We also understand that this unique opportunity is a way for us to continue to keep equity at the forefront of what we do, because we recognize the issues disproportionately impact Black, Indigenous, and other communities of colors. Through Trimet's reimagined public safety and security work, Multnomah County Health Department has developed and hired a program specialist senior that's housed specifically in the Health Department Director's office. The goal of this position is to work across departments and systems to coordinate and develop a transit-based behavioral health crisis program through stakeholder engagement. We know with the right touch points, resources, and services, community members are able to get the help that they need. For example, we've seen success in collaborating with Trimet and our Health Department Behavioral Health Division specific to leveraging case management services in our diversion court program. Connecting individuals who are more frequently involved in security concerns on transit to one of our staff help mitigate the impact of security events that this individual and others would have been impacted by. As a health department, we are collaborating with Trimet through regular meetings to discuss our coordination and planning efforts. With hiring the Public Health Reimagined position, this will help us plan and sustain this type of program ongoing. We recognize, and I want to reiterate, that this process is iterative. While we do some thoughtful and intentional planning, there will be continual opportunities for feedback along the way. We are also taking stock
What is
and
this?
that our
What
collaboration
is this?
is possible through multiple meetings. And we also want to highlight that this is a new role and that adjustments will be made along the way. I'd now like to introduce our new Senior Program Specialist, Leah Drebrin, who is here today.
Senior Program Specialist, everybody. Senior Program Specialist.
She is our new Public Health Behavioral Health Reimagined Community Coordinator. She will take a couple minutes to introduce herself and talk about the timeline of the work and highlight some of the current milestones. I'll hand it to Leah.
Morning. Thank you all for having me here today.
Look, there's the leadership team.
Could you please
hold them? There's the crisis team, Ribby. There they are.
microphone?
Close to the mic here.
Yes, thank you.
My name is Leah Drebin. I use she, her pronouns, and I'm the new Public Health Behavioral Health Reimagined Community Coordinator for the Health Department.
She, her pronouns.
A little bit about my background. I was born and raised here in the Portland metro area and come from a family impacted by addiction.
Eviction?
One way that it impacted me was I chose to leave home and school early in the middle of my junior year, which ultimately sent me on a life course trajectory to be here with you all today and to this work. But along that journey, there were multiple stops, but at the center of those stops was my passion for sociology and cultural anthropology. Didn't have the money at the time to take all the courses that I wanted to in those subjects, so I instead found opportunities to live and work in different areas to gain that education. Some of those opportunities led me to working in the field of hip-hop radio in Portland and Sacramento to learn about a culture that was not my own. But it also led me to moving to Hawaii, where I became a police officer for the city and county of Honolulu. And it was there that I was exposed to the broken criminal justice system and how police officers are used for social and public health issues without adequate training or support systems in place to be effective. And so after my field training, I immediately went back to school and finished my bachelor's degree and went on to obtain my master's in sociology. But while attaining my formal education, I became an instructor for the Honolulu Police Department, a remote instructor for FEMA, and switched into emergency management, where I provided training outreach for the Oahu community, schools, local businesses, and worked with city, county, state, and federal agencies in the formation of a new Type 3 incident management team. After attaining my master's, I went on into higher education to teach criminal justice courses to help expose some of the issues, the systemic issues that exist within the criminal justice system, and also discuss innovative strategies for change. And after having my son, Keikoa, I moved back to Oregon and participated in different trainings and community advisory groups that centered on equity, policing, and behavioral health crisis response, which led me to this wonderful opportunity with the health department and Trimet and the sheriff's office, where I want to assure you that, again, as someone who comes from a family impacted by addiction, and as a member of the Sunak tribe of Kodiak, whose mother works for NARA, and stepfather is a peer support specialist and drug addiction medicine specialist, that I will continue engaging those who will be directly impacted by this work and elevate the voices of those who've traditionally been left out of the decision-making process.
All right.
Next slide, please.
We like you.
And now I'm going to share the initial timeline goal and some milestones that we project to hit along the way. While there's been a recent change in Trimet's leadership, and we're still in the process of nailing down a hard timeline, I anticipate implementing pieces of the crisis intervention pilot model by the end of fiscal year 2023, and a full launch of the program by the end of fiscal year 2024. In addition, the initial timeline goal that was set by Trimet's general manager is to complete the crisis intervention model outreach by the end of fiscal year 2022. I also want to emphasize what the health director mentioned, that throughout this engagement process, there are opportunities to highlight areas for improvement and be able to address them in real time. Some of the projected milestones that we intend to hit within that timeline include the observation and analysis of mental health and de-escalation training that Trimet safety and security teams are currently receiving, the completion of stakeholder mapping, and the coordination of a data tracking system to be able to track and analyze the mental health-related incidents that Trimet and transit police respond to. Thank you for having me here today. I look forward to providing you with future updates on our progress. And now I'll turn it over to Rebecca Sanchez. Next slide, please. Thank you.
Thank you.
All right, that's great. Lovely. Keep moving.
Good morning, Rebecca. Good morning, Chair. Good morning, Commissioners. Do you mind going back one slide, please? Thank you. Thank you, Ebony and Leah. It's a pleasure to be here today. My name is Rebecca Sanchez. I use she, her, aya pronouns, and I am the Equity and Inclusion Manager for the Sheriff's Office.
Equity and Inclusion Manager for the Sheriff. Oh, God.
MCSO identifies training as one of the pillars to our systems of accountability. A solid training foundation allows for clear understanding of our laws and policies within public safety. As we worked through the technical mechanics of creating and hiring the reimagined community coordinator, we recognized there were some opportunities for shared professional development between MCSO and Trimet, and identified relevant content to begin some joint trainings. MCSO is currently supporting Trimet by leading learnings in various topics, such as mental health and crisis intervention. MCSO staff are training Trimet personnel assigned to safety and security, and contracted private security personnel in mental health first aid. MCSO also facilitated training transit police officers receiving the advanced version of mental health first aid trainings. To date, approximately half of all transit police officers have received advanced crisis intervention trainings.
Doesn't help.
As training is one of the pillars of accountability in public safety, we must continue and further push ourselves to reevaluate our past and current training practices through an equity and empowerment lens, and develop new and innovative training methods which align with community calls for racial and social justice. Next slide, please. In the fall of 2020, I began leading a group of law enforcement command members through a process to better prepare for facilitating and engaging in community listening sessions. We agreed that in order to reach the listening sessions goal of building and sustaining community trust and promote collaboration with our culturally diverse populations, training from an equity lens approach was needed.
Equity lens, oh God.
These law enforcement leaders and myself leaned heavily on the following guiding questions. How will we approach this training opportunity differently?
Oh,
and
I don't know if I can watch
are we prepared
this
to
goes
do
on
it
for an
differently?
hour, 2 hours? I can't watch 2
So
hours.
how did we attempt to do that? Co-facilitation with this approach.
Trimet's Reimagined Public Safety Initiative. These initiatives,
Safety
24 in
response
total,
team right
span
there.
5 focus areas: training, technology, communication,
Oh, wait, they've changed it from crisis response team to safety response team. Uh-huh. Well, how about that, man? Crisis. Okay, sorry.
structure, and system presence. One of our key stakeholders in this work is the Reimagined Public Safety Advisory Committee that has been meeting monthly since October of 21. This 17-member committee has representatives from all 3 counties in which Trimet serves. The committee has been hard at work preparing an RFP to solicit increased diversity, equity, and inclusion trainings for the agency. The RFP will launch at the end of this month. We have made progress in in all of the initiative, especially on increasing presence on the system. On September 20th, we launched the Safety Response Team, a 20-member team from diverse backgrounds with a mix of formal education and lived experience expertise to provide support to all riders on the system.
They are a friendly face on the system that provide resource navigation in addition to basic supplies, including bottled water, basic first aid supplies, rain ponchos, and granola bars, as well as resource referral. Between implementation in September and the end of 2021, the team had made over 3,900 contacts with riders.
3,900 contacts. 3,900 contacts. Well, I didn't hear any of them on the bus. We just heard that they were riding the bus yesterday. That's the first I've heard of them on the bus side. I believe I've heard some calls on the MAC side.
Please. When I started in this role, I was having many one-off meetings with peers across the country regarding similar programs as the Reimagine initiatives. I quickly recognized the need to create a space where these issues can be discussed collectively and organizations can bounce ideas off of each other. This has grown into a monthly meeting attended by roughly 15 agencies with a plan for an annual workshop. And although no two agencies are the same, we each have unique factors that have created current challenges. We are all facing similar situations in regards to homelessness and mental and behavioral health challenges impacting transit operations. Every month, with the support of Transit Police Chief and CSO Captain Brent Leger, we meet with more than a dozen transit agencies across the country, including CAT Metro in Austin, Texas, San Diego Metropolitan Transit, the BART system from San Francisco, Octa, Orange County, California, DART in Dallas, MARTA in Atlanta, RTD in Denver, Colorado, Metro of Houston, Texas, Sound Transit, LA Metro of Los Angeles, and SEPTA of Philadelphia. Additionally, this group is supported by Portland State University TREC, the Transportation Research and Education Center, professors that are actively developing a guide for public transportation agencies and concerned stakeholders on effective approaches and best practices that are responsive to those who are experiencing homelessness. Their work is funded by the National Academies of Science, Engineering, and Medicine through the TRB, Transportation Research Board. Essentially, they are creating a best practices guide for transit agencies. We also use this time to hear from successful programs at transit agencies or organizations doing this work that we could implement here.
You see what they do? They can't think of what to do. I mean, I could think of what to do. Rippy could think of what to do. You get a team out there and help the people in the ditch, okay? You ask them what do they need, okay? That's what you do. This is not fucking rocket science. But these fucking bureaucracies are going to just drag this out forever like they do with every fucking issue that comes before them. They just drag it out, more committees, more meetings, drag it out, more committees, more meetings.
We have been collaborating locally.
I don't want to hear anymore.
I would like to share with you a recent story that highlights this collaborative effort to illustrate how these new practices are already making a difference.
Let's hear them.
In November, a Hillsborough police sergeant who's assigned to the transit police contacted an individual who was setting up a tent on a transit platform. During this conversation, the sergeant learned more about the individual and recognized that housing resources were absolutely critical.
Oh yeah? How did you figure that out? Jesus.
The sergeant requested the safety response team to come to their location and assist. During the contact, safety response team members were able to quickly connect with the person in need, build trust, and offer assistance immediately. The team helped the person collect their belongings and went along with them by train to a walk-in resource center. This interaction shows the possibilities of meaningful collaboration. The sergeant and safety response team members were able to connect this person with resources while also improving safety for riders and operators. And this is just one example of...
Wait a minute. You walked him into some resources agency. Well, what happened to the guy? We need to know what happened to him. I mean, just walking him into some agency doesn't tell us anything. So you walked him in, and then what happened to him? Did he actually get a place to live, or did he set up his tent somewhere else?
Many. Highlighting collaborative efforts across the system.
Oh my God, the never-ending self-congratulations just, oh my God. I mean, it's bad enough having to listen to Trimet congratulating themselves off, but these people all of these places do the same fucking thing, man. They just congratulate themselves and say how wonderful we are.
Including multiple jurisdictions to actively engage and train our front-facing employees to be a part of a positive solution. by utilizing resources more effectively and working through issues at the lowest possible level. Next slide, please. And next slide. As we recognize the immense amount of work ahead, we are also proud of the early successes and investments in our innovative public safety models. I believe MCSO truly reflects the values of Multnomah County and will continue to provide professional leadership for Trimet's public safety services. We are looking forward to continuing this work and providing further updates along the way. In closing, I would like to thank Trimet for their dedicated partnerships to the success of transit police, and I would also like to thank the Health Department for joining us in this important collaborative work. Next slide, please. We greatly appreciate your time today, and we are all happy to answer any questions that you may have. So thank you.
They gave us one example, and then all of this, how great we are. What the fuck?
Thank you. Questions from commissioners, comments as well. We're going to start with you, Commissioner.
Are they going to start cheering? Maybe I'd better key up the fucking...
Thank you. Thank you so much, Under Sheriff, and also to Director Clark and Leah, and with you brought such an incredible... You bring such an incredible array of experience to this role. It's really mind-blowing, and we are so lucky to have you in that position. And then also Rebecca and Marissa, I don't really have any questions at this point. I just...
Oh, by the way, Trimet, you notice how they're all meeting in person? Do you notice that, Trimet? How come you're not doing that? How come you're the most chicken shit bureaucrats in the country right now?
Want to express appreciation for the degree of engagement, the collaboration you have really put into play in coming up with this responsive team that is meeting the needs of our community, that it's not just imposing something, but is really focusing on what people need and how we can support people and keep them safe. So I just really look forward to continuing to hear how this program evolves, and appreciate all of you and your team's work on this. So thank you.
Mr. Chaipal. Thank you, Chair. Thank you, Under Sheriff Morrissey, and everybody else for the presentation of the work. This really was heartening and exciting to see this approach, which feels very new to me, and the fact that, you know, the collaboration with other agencies, I think that's terrific. The community engagement. I did have a couple of questions. In terms of the timeline, and I may have heard this wrong, I thought I heard a December or end of the year 23 for kind of pieces of the implement.
What? End of December 2023 before you actually get this going? What?
Initial implementation of the behavioral health crisis response. Just curious about what the milestones will be along the way. That's still 2 years away. That feels
something, but is really focusing.
I gotta go back on this. Sorry. I mean, this is just, I got to get this.
On what people need and how we can support people and keep them safe. Yeah. So I just really look forward to continuing to hear how this program evolves, and appreciate all of you and your team's work on this. So thank you.
Wait a minute.
Mr. Chaipal. Thank you, Chair. Thank you, Under Sheriff Morrissey, and everybody else for the presentation of the work. This really was heartening and exciting to see this approach, which feels very new to me, and the fact that, you know, the collaboration with other agencies, I think that's terrific. The community engagement. I did have a couple of questions. In terms of the timeline, and I may have heard this wrong, I thought I heard a December or end of the year 23 for kind of pieces of the implement.
Did you hear that? the end of the year 2023. Did you fucking hear that? That's a fucking joke. I'm cutting it there because what's the point of listening to this?